to you by... Most people who are hospitalized with severe COVID-19 typically have an underlying medical condition like diabetes, hypertension, or obesity.
Say, for instance, persons who may be diabetic because of the insulin resistance, or the body is not dealing with sugar in the way that it should, then they have a high risk of complications. So when they get a condition such as COVID-19, their body cannot build the immune response that is necessary.
So what goes into your body is very important. Dr. Joan Smith is a nutritionist and lecturer at the University of the West Indies, Mona. She says consuming fruits, vegetables, and protein can help boost your immune system.
So vitamin C, we can get these from our oranges, from our citrus foods, and we can also get these some foods like the June plum. These things that we get in our regular Jamaican diet. And especially when the fruits are in season, we should try to eat these fruits. And also for protein. So protein we get from our legumes, like our beans, like red beans, and our kidney beans. And also we get these from our meats, such as chicken, beef.
And if you don't like the taste,
so you can blend your kale, your spinach, your cucumber together with your carrots, your bananas, your papaya. So all these things can be blended together into a smoothie. Another way of doing it is also combined with your protein. So say you're making your chicken or you're making your fish, you would add your vegetables in there when you're cooking the protein so that you can ensure that you have both your protein source and the vegetables that you need in your diet.
And remember to exercise, rest, and protect your mental health. And if you haven't taken the COVID-19 vaccine, you need to do so as soon as possible. With your health report, I'm Shamela Pullen wishing you good health.